Thank you for joining us again today, Dr. Krishan. Can you please start talking to me and sharing with our audience what rheumatic heart disease is?
So this is a really important health condition in many communities. So RHD stands for rheumatic heart disease. It's a condition that affects the valves inside the heart, and it's caused by an abnormal immune response. So the body mounts an abnormal immune response to a very common infection, a bacterial infection known as a long version, it's a group A streptococcus, but we call it strep or strep A for short. And you get this from contact with an infected person's respiratory secretion, so saliva or mucus.
It is an exchange of saliva.
Or mucus,
What?
so respiratory secretion. So it's basically spread through droplets in the air or secretions. So like many other respiratory infections, you can get a sore throat. You can also get a fever and swollen lymph nodes in the neck. So the lymph nodes are small glands. So they're like broad beans, bean-shaped glands. They're part of the immune system, and they become enlarged when your body's fighting an infection or an illness. So you can also get headache, fatigue, and body aches. But it's important to note that not everybody with strep A infection will have all of these symptoms. So the sore throat is probably the most common symptom.
Okay, so what are some other symptoms that there are for people?
Yeah. So sore throat, obviously very common. If you have a fever that goes along with that, or these enlarged lymph nodes in your neck, then there's some signs that you probably should go to or that you should go to a doctor or a health worker and get it checked out to see if it might be caused by strep A. And that's important because if it is caused by that, then you may need antibiotic treatment to prevent you getting rheumatic heart disease, which is obviously much more serious, down the track.
Okay, so it starts with some symptoms of a sore throat. And so does that mean like an itchy throat or like inflamed? Or like sometimes I know when I get a flu or some cold symptoms, I feel like sometimes my glands are really swollen and it's sometimes hard to swallow. Are we talking about symptoms similar to that?
Yeah, exactly. It's exactly the same as any other sore throat, and you wouldn't be able to tell from your symptoms alone or your throat symptoms alone whether it's caused by strep A infection or not. So that's why it's important to go and see a doctor, especially if you have a fever or enlarged lymph glands, to go and see a doctor and get it checked out to see if it might be strep A. And this is, it's especially common and especially important in, children and teenagers as well.
Okay, so what we know is that it can start out as being something that we might think just might be a common cold, some early symptoms of a flu, and you'll just kind of sort it out. So sometimes people will leave things like that. I know I'm certainly guilty of that, but looking out for other symptoms around your lymph nodes, and I'm assuming you just feel around underneath your neck and behind
Yep.
your ear. That's where they
Yeah,
are, right?
just behind your ears and around the sides of your neck as well. Yep, correct.
Okay, all right. So if that's swollen, it's inflamed, it's starting to hurt, then go to the doctor and have a
Yep,
conversation about, is this something potentially a bit more serious?
yep. And if you're having fevers as well. So most sore throats are caused by viruses, and they just pass, and you don't need any antibiotics or anything. But if it is caused by strep, strep A, then it does need antibiotics, and that's why it's important to go and see a doctor.
We know that there are some common cold and flu symptoms, right? I just want to keep reiterating this
Okay.
for
Yep.
me so I can make sense of it because we do tend to ignore the common, flu symptoms, but sometimes it can be more serious. So, how common is strep A?
Yep. So these infections are actually quite common, especially in children and teenagers. So most sore throats are caused by a virus and don't need any treatment. But in children, it's estimated that up to almost a third of the sore throats that they get are actually caused by strep A. And so that's why they need to, it's always wise to see a doctor to see if it might be caused by strep A, because then you will need antibiotics. Now, I should just, maybe put this into perspective. Not all strep A infections will lead to rheumatic heart disease. So it is a rare complication that occurs in a small percentage of cases, but it can happen, which is why it is certainly worthwhile going and seeing a health worker to see if it is caused by strep A, because if the sore throat is caused by that, then it should be treated to prevent that risk of it progressing to rheumatic heart disease when a person's a bit older.
Okay, so how do you test? How does someone get tested for rheumatic heart disease if it's progressed to that point?
So, do you mean for down the track? Okay, so they'll usually
Yeah,
get
down the track.
get some symptoms of heart disease, or heart failure, or problems breathing, and so the way that you look at heart valves is with an ultrasound. So an ultrasound probe over your chest wall to have a look to see how your heart valves are functioning. It's a special type of ultrasound, but it uses the same principles. And there are various other heart tests that would be done as well. Obviously, you don't want to get to that stage where you've already got symptoms from rheumatic heart disease, because then obviously, that is a serious medical condition that will need lifelong treatment. So, the best way is prevention, as we've discussed before. If you do have a sore throat, especially if there are enlarged lymph glands or fever, to go and see your health worker to see, and especially in children and teenagers, to see if it might be caused by strep A.
Okay, so when you say a special ultrasound, that makes me believe that I then would need to see a specialist, like a cardiologist or someone like that, to have a look at my heart and what's going on. Is that correct?
Correct, yes. So if rheumatic heart disease is suspected, it would be looked at by a specialist and evaluated by specialists. And if you need treatment, that would be through cardiologists, or if it's very severe and progressing, potentially even a heart surgeon down the track. But certainly everyone will be doing everything they can to hopefully prevent things from getting to that stage.
So, how is rheumatic heart disease treated when you've been diagnosed with it?
So unfortunately, there's no cure for rheumatic heart disease. So treatment typically involves managing symptoms and preventing further damage to your heart. And so this can involve certain medications to control blood pressure, to reduce fluid buildup in the lungs. And in some cases, if the damage to the valves continues to get worse, surgery in some cases to fix up the valves, or to even replace them with artificial valves if needed. The important thing to note is that if you've been prescribed antibiotics for a sore throat, for a strep A sore throat, for rheumatic fever, and for heart disease, it's to make sure that you complete the course and you continue the treatment for as long as has been prescribed and recommended by your doctor. And if you do that, it minimises the chance of you developing more severe rheumatic heart disease down the track.
Dr. Krishan, it sounds like rheumatic heart disease is really difficult to manage in a lot of circumstances, and it is a lifelong chronic disease that people have to live with. It's fairly complex, and when we take into consideration the remoteness of some of our communities where rheumatic heart disease can be fairly common, it's difficult, right? Like it's hard to be able to I guess to live with this illness. How do we prevent it from happening in communities? How do we get on top of rheumatic heart disease from your perspective?
So this is another condition where prevention is certainly better than a cure. And so, the best way to prevent rheumatic heart disease is to prevent infections with strep A. So strep A, sore throat. And it's spread from person to person, as we mentioned. So, practicing good hygiene, washing our hands regularly. And if you see, people who are sick in your household, if you can, avoid close contact with them. And, if you do get a sore throat yourself, it's important to get checked out by a health worker, especially if you have some of those other symptoms like a fever or swollen lymph nodes. And as I mentioned, if you are diagnosed, make sure you take all of the antibiotics that have been prescribed to you to prevent some of those long-term complications such as rheumatic heart disease.
Okay, so don't take the medicine until you feel better. Take the medicine until all the medication is done.
Absolutely, because you might feel better soon, but you need to continue and complete the course of treatment to make sure that the bug isn't still around and causes some of those complications.
Thank you. Thanks so much for that, Dr. Krishan. Really helpful information. Is there anything else that you would like to add before we wrap up?
Just that really to re-emphasize that people should take sore throats seriously, even if they don't seem too serious, especially in children and teenagers. As I said, most commonly it's caused by a virus, but it may be caused by strep A. And if that's the case and it's not treated, and your body does mount that abnormal immune response to the bug, you could get serious heart complications down the tracks. So please always seek advice from your medical service or health worker.
Okay, thanks so much, Dr. Krishan, today for all your information, all your insights.
Thanks, Dixie.